Between 1946 and 1964, the first electric clothes dryer was invented. Disneyland opened. Beatlemania swept across the globe, and approximately 76 million babies were born in the U.S. alone. Those babies are now called boomers, and in 2008 and beyond, they're facing an ominous challenge: old age in a new age.
Really, there are what I call the 3 C's. There's the complexity of the patient, which is going to increase. There's the caregiver shortage, which is a major problem and is going to be a crisis in this country very soon. And there's a communication problem. We don't do a very good job of explaining how we should be caring for folks and what kinds of symptoms they have, especially as we cross care settings. So I think those challenges are going to be the primary ones for us baby boomers as we age.
By 2020, the number of senior citizens in America will double, hitting 70 million, and it's estimated that 12 million of these seniors will need some kind of care.
That care is going to have to be provided in a variety of settings. It's going to have to be provided in the home, because obviously society would like to keep people in their homes as long as possible. So we're going to have ways of caring for people who are aging in place. But we're also going to have to care for folks in settings that take advantage of economies of scale, both economically and medically.
Forward-thinking caregivers are offering a host of options to elders who have needs that may include everything from long-term acute care to nursing homes to basic outpatient services.
The care that the aging population is going to require is very complex. It's complex in terms of its medical and clinical needs, but one of the problems is that in addition to medical and clinical care, there are serious social, spiritual, and emotional issues that now are faced by our elderly population.
One company that is prepared to meet this boom of aging boomers is Kindred Healthcare, which provides an array of services to thousands of patients a day across a spectrum of the post-acute landscape.
The essence of our mission is to provide hope, preserve dignity, and speed in the recovery process of patients with chronic conditions and the elderly who need extended care services.
Kindred Healthcare uses an innovative team approach to care for patients with multi-system failure. Its long-term acute care hospitals feature an interdisciplinary environment where physicians, nurses, therapists, nutritionists, and social workers combine their expertise to provide quality care. Kindred Hospital Cleveland is a long-term acute care hospital that specializes in providing care for medically complex patients.
Long-term acute care hospitals typically care for patients with chronic conditions who are medically unstable and require that additional care that a short-term acute care hospital typically does not provide, particularly an interdisciplinary approach that teams physicians and nurses and therapists typically over a 30-day period to get people home.
As a resident of Kindred Nursing Center, you receive a full range of nursing and medical care to meet your individual needs, including rehabilitative services, long-term skilled care, or treatment for Alzheimer's disease and related dementia.
Well, in our skilled nursing facilities, we sort of have a different strategy than your traditional nursing home. In our transitional care units, we're really focused on short-term recovery. Patients suffering from strokes, patients who are recovering from hip replacement, and we try to do that in an environment that brings therapists and nurses and physicians together to try to get people home, and that's really our principal mission.
We have a comprehensive physical therapy, occupational therapy, and speech therapy services here at the Greens that are very successful in ensuring our patients return back to the community to meet their particular discharge goals.
Residents of Kindred Nursing Center or assisted living residents also enjoy a variety of services from housekeeping to restaurant quality dining that helps them remain independent. Apartments are designed to provide privacy, but with easy access to activities and companionship.
The Greens is located in the heart of Lyndhurst, Ohio, on the grounds of what actually used to be a golf course. So when the Greens was built, they did their best to make sure that we maintain that park-like atmosphere. With our ponds, we attract all sorts of geese and ducks, and in the spring months, we're able to watch the ducklings. Residents actually get to go out and interact and watch as they follow their mother around the grounds.
This is exactly like my living room at home.
They have their rooms cleaned once a week to get our 3 meals a day. And they have a lot of entertainment here for you. They also take you out a couple of times a month to restaurants. So it's a busy place.
There's quite a lot of activities. The activities that I like are the musical ones. We have somebody come in and play the accordion or the organ, and they sing. And we have bingo. Everybody likes bingo. And we have another game called LCR. And that's fun because we're all at the table and it's kind of sociable.
To me, I have a beautiful apartment. You can decorate it to your own taste. And I mean, once you close your door, you have the privacy.
I like the activities and I like the care. I have been in 4 other rehabs in the last 5 years. And this is by far the nicest.
We provide individual and group activities for our residents, providing spiritual and cultural interests. We also have social services that can work with residents individually as we recognize they may be going through life changes that it can be hard to adapt to.
The word kindred has many meanings. Kindred Healthcare believes the name reflects its business as well as its values. They are dedicated to promoting healing, providing hope, preserving dignity, and producing value for each patient, resident, family member, customer, and employee they serve.
Well, the future of healthcare, we see it. It needs to be a partnership between physicians, between providers such as ourselves to meet the growing demand of the elderly and of patients with chronic conditions. And it's our hope to be part of the solution of that challenge that we faced, bringing people together in our network of hospitals and nursing centers across the country.
For more information about Kindred Healthcare and its continuum of care, visit kindredhealthcare.com.